Vision. Seeing with our eyes the people and the things around us, our reality. In a mirror, seeing ourselves and where we have come from, our past. Through the Hubble telescope, seeing 12 billion light years away, unimaginable. For the vision impaired, seeing through our other senses. Vision, an ability or imagination to think about or plan the future for the way things might be. Before we discuss Vision 2020 with our lineup of respected and highly motivated guest pharmacists, let's take a moment to explain FIP and the community pharmacy section. FIP, through associations and individual pharmacists and pharmaceutical scientists, and representing 3 million practitioners, brings together people committed to improving global health. One of the several interest groups and sections of FIP is the Community Pharmacy Section, CPS. The section seeks to be another touch point for community pharmacists to help them in the delivery of medicines, health products, and services that will improve medicine use and advance patient care. One recent project developed by the section has been Vision 2020, led by Emma Polino of Portugal, a look into the near future of and to highlight the key components in community pharmacy practice. In this video, 10 internationally recognized pharmacists will speak to each of these key components. At the end of the video, we will post a web link to the references and resources associated with each topic as provided by our guests. The Community Pharmacy section sincerely thanks our guests for sharing their time, knowledge, and opinions on the CPS Vision 2020. My name is Warren Meek, President of C7 Consulting, and I am pleased to be the narrator for this video. Our first guest is Dr. Charlie Benrimoj from Australia, speaking with us on financial viability and sustainability. Charlie, thanks for joining us. We hear in some circles that community pharmacies are at severe financial risk. What's your opinion?
Financial risk is mainly, I think, in independent community pharmacy. What we're seeing nowadays is quite a lot of pressure in terms of bringing the price of drugs down, and that's both in terms of generic medications is having that pressure, plus governments can easily target the drug budgets.
And the consequences of this pressure has been lower profit levels?
A number of people think that that was inevitable, that this reduction in profits was going to occur. And therefore, community pharmacy just has to adjust to lower profits and run their business with lower profits. So the profits that we used to make in community pharmacy, generally people think will never come back. And that is putting the whole situation in financial risk. The other issues is how pharmacists are responding to these financial risks. I think they're not adjusting to the fact that there will be less return of investment. And therefore, they are really trying to reduce their costs instead of looking at ways in which they can increase their business.
The current economic model for pharmacies is based on the provision of products. How will pharmacies adapt to a future where pharmacy is a provider of knowledge and service?
Yeah, look, I mean, the first point to make is that we will always be product providers, because our accessibility and our profession has been based on the product knowledge really surrounding that product. So that's a very first point. I don't think a pure service model without product is a good model for the profession. The second point to make is that services are very important. However, I think we're in a position where services themselves in most countries do not give us the volume of dollars. For example, in Australia, if you separate the professional fee, which can be considered as a service, the amount of money available for payment for services from government is only in the order of 4% of the total remuneration. So governments themselves, and we don't see many different positions. There's probably about 4 or 5 countries in the world where there is some money for service. So this transition period is a critical period. So we've got to be looking, if we're going to change our economic model to be a service-driven model, we need to find sufficient income from services to be able to have a good foundation for that model. At the moment, I don't think we do have. However, what we can say is that if we can move to a model where the service drives the product rather than the product drives the services, I think we've got a good economic model there.
All payers of pharmacy goods and services seem to be continually focused on cost. Is there any risk to that focus, Charlie? And if so, to where would you change the focus?
Yeah, look, I mean, there is obvious focus on cost because any government's got to make sure that they use their taxpayers' money correctly. And one cannot realistically expect a view to be driven away from cost. However, I think there's lots of literature and a lot of evidence to say that we can actually optimize the use of medications, which will, one, reduce costs in other areas. That's clear. And two, that if governments are spending so much money on medications, then we can, I suppose, sell the concept that we need to get quality out of that expenditure so that there is an investment element to that. Now, health is clearly an investment in public health. And I think that argument would go. And, I do see in government policy across the world, in different terminologies, quality use of medicines, rational use of medicines, etc. And that is a quality element. However, I don't think community pharmacy particularly, we've sold that story really well. But we are seeing some people increasingly basing their economic model on a service product balance and slowly changing that balance. And that's where I think the real issue will be, or the real challenge will be, where is that balance? Where's the economic balance for that? Where's the professional balance with it? And then how do we add quality to that model?
Can community pharmacy ever be truly integrated into healthcare and health systems without divesting itself from the delivery of the product?
Yeah. Look, I think that we're optimally placed to be integrated into the healthcare system, and we can use this service provision as part of that process. So my view is that we should not concentrate on services too much, which are just services dependent on what we can do. Obviously, there's going to be a range of services that will be just come from the pharmacy, but the more services we work that develop the collaboration between healthcare professions, the better we integrate the new services in terms of exchanging information about what we do, about doing collaborative work, the better. The real critical issue is how, when we go into this service product model, whichever balance it is, that whenever we're delivering services, we make sure ourselves that we are talking to, we're communicating, collaborating with the healthcare system at all levels, from a policy perspective, which we are really usually very good at, right down to the individual pharmacist and individual healthcare practitioner.
Charlie, from your viewpoint, how would you summarize the topic?
The financial risks that everybody's sort of suffering from now is leading to some negative views about the profession. I think that that's wrong. I think what's actually happening is we're going through a state of change, and we're going to be a much better industry economically, and we're going to be a much better industry professionally as a result of this pressure.
Thanks, Charlie, for this. Nice slingshot, Blue Man.